Governor, with the restaurants reopening and you keeping a contact log of customers, will the restaurant have to close if they find out a customer came in who was sick? Or what's the protocol if they have a sick staffer or a sick customer come in?
So that's not currently what we're thinking. What we're thinking is that they would reach out to the other people that were there that evening and then continue do a contact tracing initiative. If it's a employee who is sick, then we would treat that like any other place of work, which is to say everyone who is around them should get tested, all the other employees, and that sick employee would have to obviously isolate. But no, the hope is, and so right now, what we're very focused on is figuring out how to deal with outbreaks. And again, I was on a call earlier with the governors. You're seeing outbreaks all over the country. Meat processing plants, factories, we've seen in here, nursing homes, the veterans home, a couple of manufacturers. So our goal is if there's an outbreak to have everybody tested within a day or less, everybody quarantined as necessary, and then all the contact tracing done. We don't want to be in the business of having to close down any businesses really again from this point forward.
Knowing what you guys know about the virus, and I guess I would ask all three of you, do you plan to go to restaurants on May 18th?
I do. I don't know if I'll be able to get out on May 18th exactly, but I feel confident enough to do it, and I'm gonna do it, lead by example, and encourage other people to do it too.
The two of you?
Yes, looking forward to it. Will this contact tracing method be used in any other businesses besides restaurants, grocery stores, or anything like that?
Okay, that's a great question. We hope that every business encourages their employees to engage with our contact tracing. And later this week or next week when we roll out the one-stop app, we're going to be encouraging every single Rhode Islander to use it. We can't force anyone. We're not going to force anyone. All of this will always be opt-in. But over the weekend, Stefan and I had a call with a lot of business owners, showing them what we're thinking of in terms of the Contact Tracing Act and encouraging them to encourage their employees to use it. It's only as good as a lot of us using it. Like if 10% of Rhode Island's population opts in, this won't be effective. So yes, we're going to be encouraging everyone to do the same thing.
I got a question this morning from a viewer named Mike about youth sports. Mm-hmm. And he said a lot of families are struggling to figure out, there's costs for travel and things, and when even could youth sports begin? How long should they assume they are off? I realize there's a lot unknown, but can you speak to that a little bit for families wondering? Or Dr. Nicole?
I'll go first and then we'll turn it over to Nicole. I'm hoping that Thursday or Friday this week I'm going to have something to say about summer camps. If not, maybe next Monday or Tuesday. We want to be enabling as much summer camp and sports as possible this summer under a new set of rules. And, at the moment, that's pretty much what we have to say.
Regarding youth sports, the Centers for Disease Control and Prevention has just issued guidance for all of public health on the approach that we will be taking. So similar to how we have done it with the additional guidance that occurs, we'll align that with what works well for Rhode Island and make sure that we have a safe approach for going forward.
Can you just give a sense, what's the high-level guidance from CDC on youth sports?
The high level is it is challenging to maintain the distance that's needed within a sports environment. So we will need to look into what creative ways may be possible for the activity, the physical activity, to still be engaged.
Depends on the sport, too.
Yeah.
Like golf.
Yeah, for instance, everyone's already allowed to golf. So if it's a youth sport that's golfing or swimming or tennis, that's very different than, lacrosse or football, something else that's a real contact sport. So my goal is to enable as much summer camp and youth sports as possible in, following the doctor's rules around what we're allowed to do.
You mentioned the 20, oh, go ahead, John.
Yeah, John.
Governor, in your opening remarks, you talked about parks. You mentioned them. I know a lot of parks remain closed. What is your plan in terms of opening those?
Yeah. So we opened a lot of parks over the weekend, and we had a great weekend. We saw no instances of congregations over the weekend. Having said that, it was not great weather. So phase one will probably last a couple of weeks, and if it goes well, then I'd like to open more parks. We're also working on, we'd like to open the beaches. You know, probably not before Memorial Day, but the goal would be try for these next couple of weeks with a handful of state parks. If it goes well, open the rest of state parks. If it goes well, let's get the beaches back open for the summer.
Coordinating that with the cities and towns, because some of these parks, for example, Rocky Point and Warwick or Goddard Park, are also, you know, used as sort of municipal parks.
Yeah. So we are. So Goddard Park's a state park. If it's a state park, Janet Coit is working with us to reopen them. Having said that, we're working really hard with municipalities, and it would be my hope that they would follow our lead and we would all do the same thing at the same time. Having said that, you know, at the end of the day, it's up to the mayor to do what he or she feels is right for their city.
Governor, will anyone be checking in on these restaurants to make sure that they're doing contact tracing and screening at the door?
Yes. So we have established a team of inspectors which is a team of people from DBR and Department of Health to do inspections of all businesses to make sure they're complying with the new COVID regulations, including restaurants. So there will be enhanced inspections. Like this past weekend, I think we inspected a couple hundred retailers, and we will continue to do that. So every day, every weekend, as restaurants open, we'll be out with inspectors, really with the goal of helping them comply, not with the goal of punishing them. And what was the second question?
That was it, you heard it.
Okay.
If you're allowing 5 people at a table in a restaurant, does that mean the overall gathering limit is going to increase next week as well from the current 5 if there are people in that close proximity?
I don't know. I hope so, but I don't know.
Governor, with regard to the next federal stimulus package, the Washington Post reported that the White House had at least temporarily ended negotiations with Congress, and Politico reported that they're not expecting any movement on that for about 8 weeks. That's their best guess. Have you talked to the round congressional delegation on that subject, and what would be the effect on Rhode Island and its financial situation if the next stimulus is that far off?
Yeah, that would be devastating on Rhode Island, and I would suggest every other state. I talked to both Senator Reid and Congressman Cicilline over the weekend. I talked to our federal delegation almost every day. I will say this morning, we governors were on a briefing call with the White House, Secretary Mnuchin. That was not their representation. They represented to us as recently as 2 hours ago that, which is consistent with what our CODEL is saying, that negotiations are ongoing right now and that it's a matter of weeks, not months. So it is my strong position that Rhode Island absolutely needs an additional round of stimulus. The last round of stimulus we're not allowed to use for revenue shortfall. The Trump administration and Secretary Mnuchin and our CODEL have been crystal clear. That $1.25 billion is to meet the immediate needs of the crisis, whether they be economic or public health or PPE or nursing homes or hospitals. We are not allowed to use that to backfill our deficit, which is substantial. And so we 100% need, and I will fight for, that additional stimulus. And from everything that I'm being told from the administration, from the Treasury Secretary, from our congressional delegation, they're hard at work negotiating that right now, and they're telling us it's weeks. They're telling us it's 3 weeks, not 8 weeks. Yeah.
Ronaldo,
it's a two-part question. First, what is the number for the Latino community? And second, why do you allow an advertising agency to do outreach to the Latino community. And what is the budget? Because they're spending only a few $1,000s with the Latino station, and we are 45%. How do you want to reach the community with a few $1,000s spent in Latino stations?
Yeah. So listen, we are working overtime to communicate to the Latino community. This press conference has been 63 days in a row, translated in Spanish. It's much more than a few $1,000s. We've massively ramped up our testing in heavily Latino communities. I've done a lot of radio. My members of my staff do Facebook and radio every single day. I have twice weekly phone calls with a Latino advisory group that we have set up. So we can always do better. And it's my hope that tomorrow we'll do more to reach the community than today. But to suggest that it's just a small effort isn't true. We have doubled down on our efforts. In fact, just the other day I was on the phone with Mayor Diosa, Mayor Alorza, trying to reach into the community. Right now, my top priority, I was saying to Brian, one priority is making sure we can deal with outbreaks. I worry about that. There will be outbreaks. We need to get on them. We need to shut them down. I worry about the undocumented community. I worry about the Latino community. I worry about inner city communities where we're still seeing high percentages of positives, which hurts the community and frankly puts at risk the rest of the state. So if you have ideas of what more we can do, I will be wide open to it, but we are doing a lot.
Money to the Latino station. Don't give money to Latino public radio. Invest money with every Latino station. You're not doing that. You're using RTW to do a campaign that is not reaching the community. You need to do more. What is the number? 45%, 60%? Give us the real number for the Latino community and invest the money. You're spending millions of dollars building hospitals. Invest the money in the community. That's what you got to do.
Thank you for that. We do have a team that's focused, and we'll continue to get that input on how to go forward. To be able to share what the numbers are for race and ethnicity among cases, 44% of cases are among Latinos, 13% of cases are among African American, and 39% of cases are among Caucasians. That translates into our rates by cases, where 1,129 cases per 100,000 is among Latinos, 911 cases per 100,000 is among African Americans, and 220 cases per 100,000 is among Caucasians. So this continues to be a top priority, and we'll continue to take the feedback needed.
A couple weeks ago, you talked a little bit about the elderly potentially having different restrictions than everybody else. Is that still a thing that you're thinking? Are you going to actually roll something out?
Yeah. So I don't think that we've been spending a lot of time on this. It's a complicated issue, and as I've said so many times, we could never do anything that would appear to be in any way discriminatory. So I think we are not going to have, we're going to continue to prohibit visitors to nursing homes and assisted living. We're going to continue to encourage retailers and grocers to have accommodations for seniors. We're going to continue to and enhance our ability to strongly encourage employers to provide accommodations for their older employees, but it's not likely that we're going to have any official separate regulations.
Governor, we're getting, even today on Twitter, again, people saying she's opening restaurants and we still can't go to church from people who want to be able to have a service. Where's your head at right now on getting guidance out that allows some limited religious services?
Yeah, it's a really good question. We worked hard Friday, Saturday, yesterday with faith leaders of all denominations. So we've eased up a bit, which is to say that the 10-person rule for funerals and the 5-person rule for faith-based gatherings. We're going to, in the next couple of weeks. And by the way, that's consistent with the timeline that we're hearing from bishops and rabbis and faith leaders. They're saying that they want to go slow as well. And by the way, I don't blame them. I mean, there's a lot churches are very large. They attract often an older population. There's hymnals and such where you share paper, communion. We've had hours of discussion around how you safely distribute communion. So I miss church too. We're doing it like our pastor is streaming church and we sit as a family in front of our computer. It's a couple of weeks away. That's a long-winded way of saying it's a couple of weeks away. It's going to happen in the month of May. And we're just being cautious in light of everything that I said.
Take the red bandana and then Brian.
Who is that masked man?
It stands to reason that as the state opens up, cases will increase. And if that happens, is there a level of increase that's considered tolerable when considering moving to the next phase?
So again, later this week, it's exactly what we're studying right now. We are talking to our public health officials and epidemiologists, the CDC, Johns Hopkins, Rhode Island Hospital. This is the question. And I'm going to have detailed answers later this week on how we think about it. So I'm just going to leave it at that for now, but I promise we'll be back with the details.
Dr. Alexander Scott, I just want to check, was the goal met to test everybody in nursing homes by today? And now where do things stand to start repeating tests for staff and residents? And is that making a difference, do you think, in the spread?
It's an excellent question. I need to get back to you on where we are with reaching that goal. We've stretched towards that. And we've already begun preparing for the cyclical repeat of testing. We know how critical that is. There are discussions on getting the supplies that we need to make that happen and already have the team in place to be able to implement it. So that's what we're moving forward with as a priority for testing.
Doctor, if I could follow up quickly on the question from Latino Public Radio earlier. You've been collecting race and ethnicity data for quite a long time now, several weeks anyway, as long as the crisis is present. And you have speculated, everybody speculated on why certain communities, Latino community, the Black community, are being disproportionately affected. But at this point, do we have enough data to make any data-driven inferences as to why those communities are particularly disproportionately affected, and what specific actions can be done in response to those data-driven factors?
One of our most targeted data-driven response is to recognize that many of the people who are from the communities that are disproportionately impacted also comprise the critical infrastructure workforce, whether with manufacturing or with congregate settings or with retail and restaurants. So in partnership with Secretary, we have worked diligently to make sure that the guidance is clear for businesses as we go forward on how to make sure that their employees are safe. They have the masking requirements that are needed. They have the 6 feet distance that's needed. They have a representative who's able to engage directly with us on their COVID control plan and how to know the approach to contact tracing and getting the access to services needed to be able to quarantine and isolate. Critically, knowing about sick leave policies that are important to be able to support staff. Those are some of the key elements that we have used our data to drive where we need to focus, and that's something we'll continue to move forward with.
We'll get the woman on this side and then Bill, and then we'll enter to that.
Good afternoon, doctor. My question is about some symptoms, and there's just a big variety with that, with asymptomatic people all the way up to unfortunately very severe people, and people have unfortunately passed away. Is there a reason scientifically or medically that describes that large contrast?
And contrast between?
Its symptoms. People are dying, the other people don't even have symptoms.
Yeah, it's something that we are still learning with COVID-19. As I've shared before, the wide variety of presentation from those without symptoms to those who require hospitalizations is something that adds to the challenge of our response, and we will need to continue to learn more about what sets certain people to be at risk more than others, beyond what we have been saying, which is age, older age, and underlying illnesses. Even within those populations, or those who are not within those populations, what sets someone up for a negative outcome or not. So we are still learning and assessing what we can learn from children, middle-aged, and older adults as well.
Last question from Bill.
Doctor, any updates on translation and interpretation services at some of the new testing sites, the walk-up sites in Providence?
Yes, we have a robust effort now to really expand translation services, knowing the need for up to 10 languages being available. So the team that we have focused on this, our equity considerations team, that Courtney Hawkins, director of DHS, is doing a phenomenal job leading in partnership with our team and many others, our Health Equity Institute, engaging with community partners. All of that allows us to really focus the translation services on the languages that the populations who are most engaged will need. So we'll hope that you'll be able to see the outcomes of that in the days and weeks to come.